So now let's discuss about pulse qualities. What comprises pulse qualities? When we talk about pulse qualities, we mean first, speed and rhythm. Second, fullness. Third, level of depth. Fourth, tension. And fifth is width or breadth. So what is speed and rhythm? We determine whether the pulse is slow or rapid, and whether the pulse has regular rhythm or irregular rhythm. Uh, Normal speed of our pulse is 4 beats for our respiratory cycle. But if our pulse rate hastens, so does our breathing. So it would always be 4 beats per breathing cycle. Therefore, it is necessary to take the patient's pulse rate according to the therapist's breathing as a guideline. Or, since we now have the clock, we could use the minute as a guide. Normal pulse is 72 beats per minute. Generally, young children have a slightly faster rate than those over middle age, which is slower. So what is a slow pulse? This is 60 beats per minute or less and shows cold or yin dominant state. Could also show a heart yang and qi deficiency. We often find that athletes and those who do regular training have a slower pulse rate. It is considered to be a sign of a well-trained heart. Exercise is good when done in moderation. When it is done to an extreme point, it can injure the heart function, causing a qi deficiency of the heart. Many sportsmen and women come to the doctor and complain that they have no energy, cannot concentrate, and feel sleepy and dull all the time. They only feel better after they do their training and when the heart rate increased. At all times, they have low energy. So slow pulse does mean heart yang and qi deficiency in every case. Now for the rapid pulse. This is 80 beats per minute or more. This is caused by heat or yang dominant state in an organ. It could also be heart yang excess or yin deficiency. Now we'll go to the rhythm. What is regular arrhythmia? This is a heart qi deficiency symptom. There are extra systoles appearing at regular and predictable intervals. It is more common when patient is at rest and tends to disappear in activity or if doing physical exercise regularly. And now for irregular arrhythmia. This is more serious and shows a yin and yang deficiency of the heart. This may occur at any time, but mostly during exertion. So in fullness, there is an excess pulse. There could also be a deficient pulse. Having felt the radial artery, you should press it slowly all the way down and then release the pressure. Normally, when you press down halfway, the pulse feels more resistant, but is weakened under heavy pressure. This shows the fullness of blood and fluid within the artery. That's the blood and yin. So for excess pulse, this shows excess yin or blood and fluid. The pulse becomes more resistant with pressure even at the deeper level. And for a deficient pulse, which is also called a hollow or empty pulse pulse becomes weaker even at light pressure. This shows a deficiency of blood in yin.